Introduction to the Cardiovascular System, a discussion of common diagnostic studies and procedures. Welcome to this podcast. This is Susan Knowles from Cochise College Nursing. The ECG or the EKG electrocardiogram is a display of the electrical activity of the heart. The ECG is a non-invasive study to measure the electrical current or impulses that the heart generates during a cardiac cycle. Electrical impulses travel through a conduction system, which we have discussed. It begins at the SA node, moving to the AV node via the internodal pathway. The ECG is a graphic display of this electrical activity within the heart. The graphic recording of the heart's electrical activity can be accomplished through a 3-lead, 5-lead, 12-lead, or continuously, as in the case of a patient who is admitted with continuous monitoring in a ICU situation, or in someone who has a home device that we will talk about on a subsequent slide, or the Holter Monitor. Again, the ECG, a non-invasive study, which measures the electrical currents or impulses that the heart generates through a cardiac cycle, is demonstrated here on this slide, which we have seen in our conduction podcast. And this is, of course, normal sinus rhythm. This slide demonstrates the standard limb leads, the right arm, left arm, and left leg, which is a representation of a 3-lead EKG. Just some of the laboratory tests that are done for patients that have a cardiovascular concern are a complete blood count, which is a CBC. Primarily what we're looking for in a CBC at this point, we're looking for anemia. So we look for anemia by two portions within the complete blood count, and that is the hematocrit level as well as the hemoglobin level. And they are generally tested together. These levels parallel each other, and they are the best determinants of the degree of anemia. Anemia is a term associated with an abnormal decrease in both the hemoglobin, the hematocrit, and the total count of the red blood cells. The red blood cell count is multiplied by 3 and should approximate the hemoglobin concentration. A chemistry and lipid panel will evaluate for both electrolytes and cholesterol levels. Of course, we will get more heavily into electrolytes when we start discussing acid-base balance, and perhaps when you have a discussion of respiratory function. We know that in order for the heart to transmit an impulse and for us to pick up electrical activity, we have to have some electrical activity within the body, and this is accomplished through the electrolytes moving in and out of the cells. And we are able to measure those electrolytes through a blood chemistry. When we look at, of course, when we're looking at the lipid panel, we're looking to see what the circulating fat is. We're looking to see whether or not the different portions of the cholesterol are the type that will lodge themselves along the blood vessels, causing narrowing of the blood vessels, which will increase the pressure within the blood vessel, which leads to cardiovascular abnormalities, or whether those plaques themselves will break off and begin to circulate around in the bloodstream, which then again gives us other problems. So we'll talk more about those at a later level, but those are the reasons why these are part of the chemistries that are obtained when we're evaluating a person for their cardiovascular illnesses or their status. cardiac markers, two in particular that we're going to talk about now, are called the troponins. Troponin is a complex of 3 contractile proteins that regulate the interaction of actin and myosin within the cell. Troponin I and troponin T are specific cardiac enzymes. They are detectable a few hours to a few days after the onset of myocardial damage. Both begin to rise within 2 to 6 hours after a myocardial infarction or heart attack, and both will return to the reference range within 7 days. Any condition that causes cardiovascular tissue damage will cause a rise in the troponins. CKMB stands for creatine kinase MB, which is specific to the myocardial muscle. So when injury occurs, the enzymes are released in the bloodstream. The levels increase and decrease in predictable time frames, so they can be very helpful in predicting the extent as well as the timing of the myocardial damage. Acute MI will release the CK in 4 to 6 hours, and then it returns to normal within 3 days. So if a patient should come into the hospital complaining of chest pain, these cardiac markers can be drawn to assess whether or not the patient has actually had myocardial damage. And generally speaking, these tests are done in a series, not just as a one-time blood test, if you will, so that you can look for a rise or a fall in these cardiac markers. Patients wear a portable ECG for a specific time frame to record the heart's activity. And this is called a Holter Monitor. It's non-invasive, meaning that there's nothing inside the body. It's worn either around the waist or over the shoulder. The ECG impulses are recorded on a magnetic tape, and the recorder has a clock that has accurate time markings. And it's used when there's suspected dysrhythmias or abnormal cardiac rhythms or unexplained symptoms. The patient is encouraged to go about their active daily living activities. They keep a diary where they can record their episodes of chest pain or anything else that they're concerned about. They can push a button when these symptoms occur. When they have pain, palpitations, they have difficulty breathing, they become dizzy. Markers are on the tape for later comparison. The Holter monitor can be used to detect dysrhythmias, exercise intolerance, chest pain, dizziness, palpitation, and syncope or dizziness. It can also be used to evaluate medication regimens and therapies, and to evaluate the function of a pacemaker. An exercise stress test is a non-invasive way to measure cardiac function during physical stress. It is primarily useful in determining the extent of coronary artery occlusion by the heart's ability to meet the additional O2 demand in response to the stress of exercising in a safe environment. The patient exercises either on a treadmill or a stationary bike to increase the cardiac function or heart rate somewhere between 80 and 90% of maximum heart rate. The patient's ECG and blood pressure are monitored during the test. The risk of doing the test is possibly suffering a myocardial infarction and death. It can actually detect irregular rhythms, peripheral artery disease, exercise-induced hypertension, as well as evaluate the effectiveness of medications and regimens. The echocardiogram is yet another non-invasive diagnostic procedure that is done to evaluate for both structural and functional changes within the heart. This ultrasound uses high-frequency sound waves to assist in diagnosing many cardiovascular disorders. The procedure actually records the echoes created by the deflections of an ultrasonic beam off of the cardiac structures, and it allows for visualization of the size, the shape, the position, the thickness, and the movement of all four valves, the atria, and the ventricles, as well as the other structures within the heart. It can also determine blood flow velocity and direction. Thank you for joining me on this podcast discussing just some of the basic studies done for diagnosing cardiovascular problems within the heart. This is Susan Knowles from Cochise College.